the Cass Health Podcast, the show where we hope to connect our community with healthcare information that's relatable, understandable, and useful to your life, and where you get to know better the neighbors providing your care here. I'm your host, Carter Anderson, and in today's episode, we'll be talking about common sinus issues with Cass Health's ENT, Dr. Rick Rinehart. Before we get started, 2 quick disclaimers. First, the comments in this podcast do not necessarily reflect the views of Cass Health. Second, the information in this podcast is not intended to be construed as personal medical advice. Always consult your primary care provider with questions and concerns regarding your health. Dr. Rinehart, thanks so much for coming back and joining us on the podcast today. For our listeners out there, we've already covered some of the get to know you questions with Dr. Rinehart, so check out our very first episode of the podcast, Season 1, Episode 1, to hear some more get to know you stuff from Dr. Rinehart. So for today, we'll just kind of skip that and jump right into our questions here. So we'll start with, how many sinuses do people typically have?
Well, thanks for having me back, Carter. Your first question, how many sinuses do we have? Interestingly, we're only born with generally 4 sinuses, and the remaining 4 sinuses develop as we age, more or less. So some people can over or underdevelop those, but so I'm waffling on answering your question, but the actual answer in full adult development would be 8 sinuses, 8 different sinuses. But it's not unusual that someone might not develop 1 or 2 of those, that you really can only pick up on as a variant, if you will, or an anatomical variant if you were to do some type of an imaging study like a sinus film or a CAT scan.
Really? So some people you're supposed to have 8, but in some cases, some people only have 6 or 7, or maybe just some people only have 4 sometimes.
Right. And the interesting thing is there's been discussion in the past about why do we even have them, right? There's these hollow places in our skull. And that's kind of how they develop as we age. By the time we're like 14 or in our teens, they have kind of hollowed out some areas up into our forehead and into the back of our skull to form those additional sinuses that make a complement of 8. People are not 100% sure why we even have sinuses. People have argued perhaps it's to make our head less heavy, to provide resonance to our voice. It has something to do with our respiration in some capacity, but there isn't really a solid answer to that.
Interesting. So it doesn't really impact you one way or another how many you have, or maybe it does. Would it impact somebody whether they have those additional sinuses fully developed or not really?
Not really, no. I mean, you might have a harder head or something, I suppose.
That's the explanation there of why some people are so hard-headed.
Yeah, maybe I don't have a full complement. Maybe that's why I have a hard head, I don't know. No, there's most people are really surprised when I tell them, oh, no, you don't even have a sinus in your forehead. They're like, what? But yeah, just kind of an interesting tidbit.
For sure. So did you kind of lay that out for us too, where those ones are located when they are fully developed?
When we're born, we have sinuses, our ethmoid sinuses that are between our eyes, kind of like where your eyeglasses would rest. People feel sinus pressure there, like on the bridge of their nose. Those are sinuses called our ethmoid sinuses. And then the other ones are the big cheek sinuses that are above our teeth or below our eyes. So those are our maxillary sinuses. So those are the 4 that we're sort of born with. The other ones develop as an extension out of that, and that will go up into our forehead region above our eyes or more deeply into our head, into the back of our sinuses to create that full number of 8.
Very cool. Thanks for kind of outlining that
kind of cool stuff.
Yeah, very interesting. I did not know that there was that many to begin with. So very cool. So we kind of talked about what sinuses are and where they're located. Mm-hmm. What are some of the main causes for sinus issues that people deal with kind of on the regular?
Yeah, that's a loaded question. I think when people feel sick in that area, everything in their mind is a sinus problem. And there's really a differentiation in an ENT viewpoint as to this. Is this a nasal problem? Or is this a sinus problem? And most people just have it's all lumped together. My sinuses are bugging me. But for some person, that might look like I just don't breathe great through my nose. And that might not even be a sinus problem. That might be a nasal problem, like a deviated septum or something along those lines, versus a sinus problem, which they might breathe fine, but have infections all the time. And so, circling back around to your question, our sinuses do get sick from time to time, and triggers for that can be something as simple as a cold or a virus that we get, and then that clogs us up, and then that might turn into a bacterial infection or even a viral sinus infection, where people have kind of the classic illness where they feel congested and draining and coughing and head pressure and teeth pain and blowing colored material out of their nose and all those icky things, where they want to maybe go see their primary care doc and be put on an antibiotic. But allergies and colds are common triggers for that.
Will a sinus infection clear up on its own, or do people need to go visit their primary care provider, something like that, to kind of clear some of those issues up?
Good question. Sinus infections can clear up on their own. It might take a little bit more time, and you may have some increased symptoms from that, but anything that would provide you some decongestant capabilities or some sinus rinsing or those sort of things can break that and ultimately open up, and you can clear up a sinus infection on your own. It can take it longer to clear up, and in some cases you could end up having progression of that to a worse problem potentially. So the usual recommendations are if you have a cold-like illness that's failing to improve after 7 to 10 days or worsening after that time frame, that could be a bacterial sinus infection, and it might warrant seeing your primary care and or getting on treatment for it. But if you've just had a cold-like illness for 3 days, there's not a lot of emphasis or evidence to support guidelines for antibiotics prior to that.
Kind of when you get to that 7 to 10 day window, and if it's not getting better or getting worse, kind of seek out additional care from there.
Correct.
How can someone tell the difference between a sinus infection, a cold, and just plain like seasonal allergies, stuff like that?
Yeah, I think that's a great question, and that's a hard answer. They look a lot the same in some cases, and so some of those pieces, like what we just talked about, the amount of time that you've had it. People that have allergies, they usually have, the classic runny, drippy, drainy, sneezy. Their drainage is more clear. It's for a more protracted period of time that seems to have a seasonal variation to it, and oftentimes responds to some of those over-the-counter things like Claritin. Versus sinus infection is usually comes on as a cold, just out of the blue, and then progresses. It's a little more hard-hitting, and there might be more color to the drainage and other symptoms. Isn't responding to over-the-counter medications and stuff as much as a allergy might. And so I think looking at the bigger picture items like how long have you had it? Is it seasonal? What are your symptoms looking like? What are you responding to? All of those things kind of have to be taken into play to say, I think this is an allergy versus a sinus infection, And so, but that's not always super clear cut.
It's kind of hard to classify those things some of the time because they all look pretty similar, I would assume, right?
Right. And I think some people get in the habit of like, I know my body and I have a sinus infection. And that may very well be true, but I think docs still in the effort to not to want to overprescribe antibiotics or those type of things. We still don't want to jump on the antibiotic bandwagon too soon for folks that just simply have a virus or a cold or an allergy. And so try to stick to the guns on some of those treatment plans. And a lot of that today is based more on evidence-based guidelines and best practices, not just our anecdotal experience like it was back in the day when I started. Character myself as a old ENT here, but back in the day it was kind of a little more based on your personal experiences, and today there's more of these evidence-based guidelines or clinical practice guidelines that we practice with.
And then part of the reason that you don't want to jump on the antibiotics bandwagon too soon, that's because of antibiotic resistance. Was there is there like a threshold or anything like that for antibiotic resistance?
Obviously, there's a lot that goes into that. I'm not just for the person's individual health and them developing maybe an allergy to an antibiotic that then they can't use in the future if they really need it, or knocking out a whole class of antibiotics that might really be beneficial in the future for them. It's not uncommon for people to get 4 or 5 colds a year, and if you're hitting all of those with antibiotics, your sensitivities of getting an infection, you might get an infection then with something that's more virulent or more pathogenic, and you might select out a bacteria for your infection that's now a more resistant bug that's harder to kill. There's oftentimes with today's higher potency antibiotics, significant side effects and other problems you can get into that now then you're fighting with that one. And so, it's interesting that, the plain old amoxicillins that have been around for time immemorial, we've used so much of those types of medications over time that even though that's still our first line recommendation for some of these things, there can be resistance to that antibiotic in anywhere up to 25 to 35% of the time, where it's not even going to work anymore. And we're not really coming up with lots of new great antibiotics these days, but our bacteria aren't getting any weaker. So we want to be prudent with what we do in that regard.
Try to use it as effectively as possible and not overuse stuff like that.
Right.
Gotcha.
100%.
Cool. So we kind of touched on this a little bit earlier, but when should someone see their primary care provider about sinus issues? Is it that still same 7-10 day window, kind of like that, or are there other recommendations too for that type of stuff?
Yeah, that's the difficult thing too, because you get sick and then you decide, man, it's been 7 to 10 days and I'm really sick and miserable and I probably need to be seen and maybe be put on an antibiotic. And then how quickly can you get in, right? I think that sometimes can lend to calling your doc and say, hey, can you just call me? And sometimes you want to help people out and do that kind of thing, but it can develop kind of a bad habit in a way. I still think it's advisable to have someone see you, and talk about some of those issues and take a look at you. And those are the most accurate ways to make these diagnoses. But yeah, I try not to prescribe antibiotics if someone hasn't been sick for a week to 10 days or show me signs of progression or some other clinical indicators that they need to be put on one, prior to that. I'm a little hesitant to pull the trigger. But yeah, I don't think that, they need to see an ENT every time they have a sinus infection, but that's a scheduling thing for them too. You guys do a great job here. A lot of my patients will say, yeah, I just popped over to rapid care or whatever. They don't always see their primary, but they still get a primary care evaluation.
Like you said, those evaluations are important because you might know your body, but it might be something that you're not expecting or something it might have present similarly, but it might be a different strain or different issue that's causing the discomfort in that sinus area, right? That it could
Right. And then, they might see something else and they might say, hey, we want to get you might have some bronchitis or want to get a chest x-ray or you didn't get better with the usual antibiotic. I want to get a culture and make sure you don't have a resistant organism that might warrant a different antibiotic because, classically when we treat people with an antibiotic, it's kind of our best guess. We call it empiric. We got to have a big word for some of those things. But, it might be that what we chose that covers most of the bacteria that might be involved, you might need something different or a different choice. It's always best to base those on cultures, but obviously that's not how ear infections or sinus infections are usually treated. We don't do a culture and wait for the results and then pick our antibiotic. And, so we take our best stab at that. So there's things you can do in an office appointment that you can't obviously do over the phone.
Right. Get the best diagnosis you can in person.
Right.
So you touched on it a little bit ago, but when should someone come in and see you as an ENT? Not for just a routine sinus infection or anything, but when should someone be like, I need to schedule an appointment with Dr. Rinehart?
Well, if we're lumping it all together on the nose items, some people might come see me because they can't breathe through their nose. They just don't get airflow through their nose and they're really stuffy and they can't breathe through there. And that might be a variety of conditions that ENTs might treat, anything from allergies to deviated septums to nasal polyps to, we'll take a look at their nose and see is there something structurally wrong with why they can't get airflow through there. And so that's a common reason people would see me, and that might get lumped under a broader heading of quote-unquote sinus. But the other reason we've spent some time talking about infections and allergies and whatnot. So they might see me because their allergies just aren't getting better with the usual thing that they're seeing with their primary care. So they want to take a deeper dive into that a little bit and start crossing things off the list about what is or is not going on. Or it might be that they're getting far too many sinus infections in a year's time, even though they may be responding to treatment appropriately. They're on number 4 or 5, 6 of a sinus infection that year. And they're just like, I'm missing too much school or work, or I'm on antibiotics constantly. And so when you start to get to numbers like that, people start seeing ENTs. And the other one just be, I don't think I'm getting over my sinus infection. I don't even know how many antibiotics I've had, but back to back, and I'm not getting well. So these are the people that start to see us to take next diagnostic steps as to, taking a good look up in their nose. Do we put a telescope in their nose and check out their anatomy? Do we do allergy testing? Do we do some type of advanced imaging of their sinuses and really start to say what's going on in there?
Is there anything you can do as an ENT to help with allergy-related sinus issues, kind of further diagnosis? Is that kind of what the next steps would be for that?
Heck yeah.
Okay. There we go. Perfect. Further diagnosis.
That's what we do. So, yeah, in my capacity here at Cass, I don't do a lot of allergy work. Historically, in my career, ENT encompasses a great deal of allergy. So you can find otolaryngologists or ENT doctors out there that practice a lot of allergy as far as like allergy testing, allergy shots, immunotherapy, desensitization, all of those things. Here at Cass Health, that's done by an allergist, but I might decide, is that appropriate or not appropriate, to make those referrals. So allergy-based management can really be ramped up with further allergy testing and allergy-directed therapy. From a sinus standpoint, a lot of what I do here in staying in my lanes as an ENT would be, really it's a baseline of, can we get you better in some fashion medically, or are you going to have some surgical approach? And there's sort of a fork in the roads there. And a lot of that is based on just, are they improving or not improving? Have we exhausted all of the things that we can think about? And, usually advanced imaging like CAT scans to say, hey, something's not anatomically correct in there, and so we're going to have to approach that in this manner or that manner. So, yeah, and there's a lot of different surgeries that we do. I think some people think, oh, my Uncle John had sinus surgery. That's like saying your Uncle John's pickup got worked on. There's a lot that you can do. It's not just one thing that we do in there. It's tailored. We talked about there's 8 different sinuses. There's deviated septums. There's polyps. There's not polyps. There's different kinds of infections and allergy overlays. And so, there's different tools that we use from, classical equipment to balloons to this to that. I mean, there's a million things that we do differently, and they're kind of tailored to the individual.
Gotcha. So kind of start at the top of the list and work your way down through and kind of figure out the best mode to treat that issue is for that patient.
Yeah. I kind of look at it more of like taking the steps up a ladder.
Gotcha.
They've gone through over-the-counter things. They've seen their primary care doctor. They've done this, that, and the other thing. And then I'd look at them and say, if we're on the right ladder or not, which is good, right? Because it might be, wow, this is more less of an infectious problem. It's more of an allergic problem. We might shift to a different ladder, or we might say, okay, the next rung up your ladder is going to be, we're going to have to get some imaging studies and see what's going on. And then they come back and say, yep, you have some polyps or deviated septum or whatever. Going to be able to take antibiotics till the cows come home and you aren't going to get better. We're going to have to go in there and we're going to have to do this, and we're going to approach this sinus and that sinus, and and I'm going to do this one with a balloon, and I'm going to do this one this way, and this is what you're looking at, or your option of keep doing what you're doing. And I lay it out for them. I sort of feel like they're part of the process of making decisions for their own health care, and I'm here to guide them on helping them make the best decisions. And especially when you're making difficult ones of whether you want to do surgery or not, you really have to feel like you've been on each rung of the ladder and sequentially gone through those to where, you're like, okay, this makes the most sense for me to take this step to try to be well.
So to kind of go back to our first rung on the ladder, so to speak,
Yeah.
Are there any good home treatments for sinus issues?
I would say, there's been a great evolution of that over my career, where when I started, people would have to come to see me to get a Claritin prescription. They'd have to come see me to get a Flonase prescription. And a lot of these medications that can be highly successful are now all over the counter. And so I do think that that's the first step, and those things can be very successful. I see the biggest problem with those in inappropriate use of those things. There's a lot of people that know that there's certain nose sprays that you're not supposed to use for too long, and these are the bad ones, and you're not supposed to use them for more than 3 days. And there are those out there. Those are usually the decongestant sprays, the 12-hour acting sprays, not to point many fingers, but those are great sprays used correctly, but like Afrins and Dristans and Neosinephrins, and if you read the bottle, it's like not more than 3 days, But I think that sometimes overlies people to where they're like, oh, I'm only going to use Flonase for 3 days. And, and unfortunately, that's not going to work. Flonase has to be used, or fluticasone or Nasacort or any of those nasal steroid sprays have to be used real consistently and compliantly to be effective. And I think most people that I talk to, more often than not, haven't been using that correctly, or they're not using it compliantly, so they're not going to get the effect.
So you should use it as prescribed, but if it's not been prescribed to you by anybody, a lot of people don't know the right way to use it, right? If it's a Flonase and you're supposed to use it for, what's the range for that? Is that one of the ones that takes longer to take effect?
They'll come in and they'll say, I've been using my Flonase. I'm like, well, how do you use it? Well, when I get bugged, something's bugging me every once in a while, I'll use it every once in a while, kind of a thing or whatever. But, typically speaking, Flonase can be used successfully for a long period of time, but it's gradual on that. And I tell people it's more designed to try to keep the peace than it is it's like a peacekeeper, not a Marine storming the beach kind of a thing,
Gotcha.
And so it might take it 2, 3, 4 weeks to be up to full effect.
Mm-hmm.
So I tell people, if you want to see what that's going to do for you, have you ever been on it for a month straight? If you use it more like that, it can be a lot more successful. And I'll find a lot of people say, oh, no, I don't like squirting stuff up my nose. I don't do that. So sometimes it's just telling people the right way to use their medication.
Mm-hmm.
And some people, similarly with Flonase, they'll tip their head way back and sniff in as hard as they can, and they'll go straight into their stomach, Mm-hmm. Our nose is what's bugging us, right? So there's some things about how you take medications, too, that are important, or when you take medications. But over-the-counter products are available today that can be very successful if used correctly. You brought up the neti pot thing to me once before,
Mm-hmm.
and these devices that rinse saline through our nose. And there's certainly no harm in any of those things, but a variety of benefits can be gained from them depending on the person, some more, some less. But ENTs are big believers in the salines in the nose. Those membranes are moist membranes. They function better if they're moist. Typically speaking, the mists are the little ones that squirt just a tiny little bit in there.
Mm-hmm.
While it might be momentarily refreshing, don't really do as much work for you as the devices that are designed to put more volume through there, like the neti pots or the Navage systems or the Neilmed bottles or something that's a more of a flush through your nose and sinuses. Those have been shown to actually be more successful in achieving the needs of the patient.
More of a deep question on those. Is it really just rinsing the snot out of your nose, or like how do those actually work? Like when you use those saline rinses and stuff,
blasting your brains out with those things.
Yeah, right, exactly.
They don't work if you can't use them, and so there's different techniques to that, and it may take some experimentation for each person to see what works the best for them, and some people can never quite exactly get it down without it being uncomfortable in some fashion. Typically, sinuses are unwell when they get obstructed or when they get blocked. And so, we normally, might be grody, but we normally make mucus and stuff in our nose, and between allergies or colds, or it can change the consistency of some of the secretions that we have, allergy seasons or cold seasons, and start declogging you up. And so certainly, rinsing some of this out of your nose can free it up to where your sinuses can then be more ventilated and not obstructed, and then they don't get sick. Or it might even just provide a little more moisture in your nose, so your sprays get applied more effectively in your nose and sinus area, so your Flonase can be more successful, get to where it needs to go. These sorts of things, the antihistamines that we pound, like the Claritins and Zyrtecs and Allegras and whatnot, they might dry your membranes a little bit in their efforts to try to make you feel better, but then your sinuses don't work quite as well, and so that might be hydrating and refreshing for those gentle membranes of our nose. And so there's a variety of functions, from cleansing to hydrating to allowing better application and use of your medications. And we use them a ton, too, in our post-op patients because it really helps them with the healing of those membranes. And so they can be very successful in post-operative patients as well.
Helping them kind of recover and help
heal better.
Those things back up after
exactly.
surgery.
I work really hard to make sure I open them really well for people, but the body's response is to want to, slap a scab on a wound and heal it over, right? And then that can close that down. And so post-operatively, keeping that open and keeping those membranes healing appropriately is critical to the success of the operation.
You just kind of touched on a little bit, but are there certain conditions or issues that surgery can help remedy? Like when you get down to that kind of fork in the road of we need surgery to help remedy the situation, are there certain things that surgery is kind of the only option?
Yeah, and I think that's a loaded question, but if we want to go on the nasal side, the people that come in to fix a deviated septum or it's crooked in their nose, guys have a high propensity of having some deviation of their septum, which is a crookedness of the wall that separates one passage from the other, and they just want to breathe better through their nose. That's a simple outpatient operation with a high level of success, and you can't put a nose spray on a crooked piece of cartilage and do anything, right? So really you're living with it or correcting it, and so that can be very successful. On the sinus side that we talked about, a lot of times our operations are designed to cut down on the number of sinus infections that people get or make their sinus infections easier to treat and less frequent, hopefully. So our goal may not be to knock it out of the park with a grand slam, but, just overall make their baseline a lot better. And certainly if their sinuses aren't draining correctly, there are some very good surgeries today that can help that quite a bit. I think one of the harder things for me and for my patients sometimes is when they have envisioned that they've had a lifelong history of chronic quote-unquote sinus. And I see them and tell them that they can't have an operation that's going to help them. And that's a little more frustrating because a lot of those people get to the point of they're willing to do anything and they're ready to have that surgery. But the CT or a CAT scan might show that they really aren't obstructed, and me opening it up isn't going to solve their problems, even though they have a lot of symptoms. So then it really takes a little more sleuthing and, challenge of, hey, you have this chronic condition of these symptoms, and how can we try to change your medical regimen to some capacity or pursue that allergy piece or whatever. But I really don't see sinus operation as in here. And that's a bummer because they kind of come in hoping that I'm going to do some miracle balloon thing and they're going to leave happy as a clam when they've had this symptom for 40 years, Right.
Like you said, get all the way up. Kind of all the way up the ladder to surgery. Never mind. Actually, we're going to go back down, take this other ladder if it's an allergist or something else to try to remedy that issue for them.
Right. And so it's really, really interesting. I've done this a long time, and people come in and they'll say, I have chronic sinus infections. I have chronic sinus infections. I never get better. I'm having forever, And what I kind of tell them is, if you've not ever been able to get better, no matter what you've done, then I'm going to start at the beginning here. And I'm going to say that I'm not just accepting it that you have chronic sinus infections. What does that mean to you? And what are we really dealing with here? Let's not go so far down a lane or a road that we might have missed something, right? Or we might be calling it something that it's not. Let's go back to, let's not even say sinus infection. Let's just say, what are your symptoms? What's wrong? What's bugging you? What has or hasn't? Haven't you tried I'm going to start like this is the first time here, and then we start getting more information and diagnostics, like maybe an allergy test or a CAT scan. I say, okay, here's what I think you really have. And it may or not even be what they thought they had.
Right.
And that's why that stuff isn't working. Sometimes you can be far down a road that wasn't the right road.
Right. And then you get back all the way back and find the right fork and then get going down the right path to getting feeling better. So.
And that's, primary care doctors are fantastic, and they manage so many different entities and so many different fields, and I have a narrow window of things that I do and do well. And so that's when it's not working out. You go talk to a guy like me and say, okay, what are we really dealing with here? And so for me, it's like back to the drawing board. It's like, what's going on?
Right. We're super lucky to have you here. I know that for sure. All the different specialties and ways that you can help people figure out their issues. So,
well, that's nice of you to say. I love being here, actually.
Good. You've enjoyed it here. Oh man, how long is it?
3 years.
3 or 4?
I've been an employee now here. I've been on staff here now for 3 years. And I think people think that they're used to seeing specialty guys and gals here. They'll ask me, where are you from? Where are you coming from? And I'm like, well, I live in Des Moines, but I'm really not coming from anywhere. This is where I work. This is my job. I'm employed here. I think they're used to thinking that I work most of the time somewhere else. I just come over here and do a little bit over here. But this is my main gig. It may not be full time, but this is my kind of home. So I don't take people back to Des Moines and operate on them. I don't take people other places and operate on them. I just serve here, the patients around here. But I'm here twice a week.
Twice a week here.
Yeah, at least.
Mondays and Tuesdays, right?
Yep, Mondays and Tuesdays. Yeah.
There we go. Perfect. So one more thing, we'll close with this. What is one thing you'd want all kind of allergy sinus issue sufferers to know as an ENT? Is there any kind of like baseline thing you'd want everybody to know?
Not everything is sinuses, as we were talking about.
Right.
It's not always, I guess I would say, start with the basics. Utilize the things that are available to you over the counter. Use them correctly. Trust the opinion of your primary care providers here at Cass Health. And if it's still frustrating and confusing, then come get my input.
There you go.
Yeah. And I might tell you what you want to hear, and I might tell you what you don't want to hear, but I'm going to tell you the truth as I see it.
Right. There you go. That's all you can ask for is the truth, and then helps you figure out the right answer. So.
Excellent. Yeah.
Alrighty.
100%.
Perfect. Thanks so much for joining us on the podcast today. It was great to chat with you, all things sinus. So maybe we'll have to have you on for another episode, talk about other stuff.
Yeah, it's great. I love it.
Awesome. Okay.
All right, man. Thanks for having me.
Yeah, thank you.